Hi, this presentation, Diagnosis and Management of Acute Stroke, will be presented by Ben Negroki, Sandra Ratliff, which is me, and Carrie Van Weeren. Developments in acute stroke therapy have followed advances in understanding three types of strokes: ischemic, hemorrhagic, and transient ischemic attack. Americans are at a high risk with strokes due to many factors, with the leading three being hypertension, hyperlipidemia, and smoking. Some other key factors are diabetes, diet habits that are high in fat, also having a sedentary lifestyle, obesity, carotid artery disease, peripheral artery disease, and cardiac arrhythmias such as atrial fibrillation and flutter. According to the Centers for Disease Control and Prevention 2017, strokes affects 800,000 people per year. The leading cause of long-term disability and cognitive impairment in the United States, and it kills more than 130,000 Americans each year. Every 4 minutes, someone dies of a stroke. It is also the fifth leading cause of death in Americans. Certain races are twice as high for having strokes. American Indians, Alaska Natives, and blacks are at a higher incidence of having acute strokes, and blacks are more likely to die following a stroke rather than other races. An estimated United States cost for 2016 were $33 billion, and this total includes the cost of healthcare services, medicines to treat the strokes, and missed days of work. Stroke risk does increase with age. However, they can occur at any age. Stroke is also known as a brain attack, where sudden loss of brain function occurs when blood supply to the brain is interrupted or severely reduced, depriving the brain tissues of oxygen. Within minutes, the cells of the brain normally die due to hypoxia, absence of oxygen. This is a diagram depicting tissue death caused by the clot that can occur in the brain. There are two major categories of stroke, ischemic and hemorrhagic. The majority of strokes is ischemic, with 80% of the incidence of strokes. This type of stroke occurs when the artery that feeds the brain is blocked by a clot, also known as a thrombus. These blood clots usually form in arteries damaged by plaque. Embolic strokes are caused by a wandering clot, an embolus that is formed in the heart and the neck arteries. These type of strokes occur from arteriosclerosis and or cardiac arrhythmias such as atrial flutter and fibrillation. Hemorrhagic strokes occur when an artery in the brain leaks blood or ruptures. This causes the leaked blood to put pressure on brain cells, which damages them. There are two types of hemorrhagic strokes: intracranial hemorrhage, which is the most common, and an artery in the brain bursts, flooding the surrounding tissues within the brain. The second type is the subarachnoid, less common, and refers to bleeding within the brain tissues that cover it, and the tissues that cover it. High blood pressure and aneurysms cause these type of strokes. This next slide is a diagram depicting the difference between the two types of strokes. Again, hemorrhagic and ischemic. During a stroke, every minute counts. The quicker you are to responding to a stroke lessens brain damage. By knowing the signs and symptoms of a stroke, you can get quick actions, perhaps decreasing the debilitation, side effects, or even death that can occur with having a stroke. The key word, as you can see on this slide, is sudden, meaning any of these symptoms occur with a sudden onset. Sudden numbness or weakness of the face, arm, or leg, especially one side of the body. Sudden mental status changes like confusion, trouble speaking, smiling, swallowing, and or difficulty understanding speech. Sudden visual changes in both eyes. Sudden trouble walking, dizziness, loss of balance, or lack of coordination. Sudden severe headache with no known cause, and the classic sign for hemorrhagic stroke is a headache. The case study we will be discussing involves a 72-year-old African-American female with a medical history of morbid obesity. She is 5'2" and 154 kilos, with uncontrolled hypertension, diabetes type 2, hyperlipidemia, atrial fibrillation, poor dietary habits with diets high in saturated fats, and a sedentary lifestyle. Patient arrived to the stroke-accredited hospital, brought in by rescue. She was at home when her husband, who stated he witnessed a sudden onset of confusion, slurred speech, and left-sided weakness. He confirmed the symptoms occurred 45 to 60 minutes ago.
Hi, my name is Carrie Van Weeren, and I'm going to be discussing the physician's orders. The patient comes in, and the initial assessment is level of consciousness. The patient's alert, reacts to painful stimuli, left-sided cerebral lesion, aphasia, left gaze preference, right-sided hemisensory loss, unable to move all four limbs equally. There's no nausea and vomiting, and of course it's important to maintain airway. Physician's orders is to perform the complete NIHSS upon admission, record time of stroke onset, record the vital signs every 5 minutes for 1 hour, perform a CT scan, put the patient on telemetry, maintain oxygen sat that's over 91% or place on 2 liters, order CBC, PT, PTT, BUN, and blood glucose. Stage 1 assessment, the patient vital signs is blood pressure is 175 over 92, heart rate is 89, respiration is 22, and the O2 sat is 89%, so the patient has been put on 2 liters of oxygen. Blood glucose is 340, A1C is 8.6%, triglycerides 385, LDL 190, HDL is 38, and the BMI is 62.2. Some nursing interventions is to monitor airway, monitor vital signs, treat high blood sugar, and perform a brief history and physical. Obviously, the patient may not be able to do this, and the husband is present, so talk to the husband about any information that he may have about her history. Stage 1 questions: what lifestyle puts her at risk for a stroke? And are African Americans more likely to have a stroke? Answer. The first question is, what lifestyle puts her at risk? Well, the patient is morbidly obese, has uncontrolled hypertension, and she's a diabetic and has high cholesterol. As far as the second question, yes, African Americans are more likely to have strokes. They are more likely to be diagnosed with diabetes and coronary heart disease. They are 50% more likely to be obese and have high cholesterol, and less likely to seek medical help.
Hi, my name is Ben. I'm doing the stage 2 of stroke. This is basically post-stroke objectives. Again, experiencing emotional changes can occur due to natural responses or changes caused by physical effects of the brain. Some examples are anger and fear, frustration, hopelessness, anxiety, and varying degrees of depression, also sadness. After stroke, the process of thinking, remembering, and recognizing things, called cognition, can become challenging. Some examples are aphasia, which is difficulty expressing yourself while speaking, trouble understanding speech, and difficulty with reading and writing, also called aphasia. Memory loss, some examples are confusion, normal thinking, and or remembering recent events. Vascular dementia, some examples: problem with reasoning, planning, judgment, memory, and other thought processes. Some nursing interventions related to stage 2. Symptoms will improve with time and rehabilitation, such as PT, OT. Become aware of the effects of stroke, how to improve your physical and well-being, physical gearing back to rehabilitation, that goes together. Gain independence in everyday living situations as well. It's 2 of the questions that I found. First question would be, does delivering oxygen to patients with normal oxygen saturation improve outcomes in cases of suspected acute ischemic stroke? That's the first question. Second question is, in what position should patients with possible strokes be transported? The answer to both of those first question's answer is yes. For acute stroke patients includes the use of supplementary oxygen to maintain the saturation above 94%. The answer to question 2, the evidence supports laying the head of the bed flat as tolerated in patients with suspected stroke. That's my part.
All right, the patient has been discharged from the hospital. After she's home, she arranges for physical therapy so that she can have full range of motion to the affected limbs. She also enlists the help of a dietitian to make healthy eating choices. She visits a physical trainer who will teach her age-appropriate activities. She takes metformin, lisinopril, simvastatin to control her many health issues. And within 6 months, the patient's lost 20 pounds. Her A1C is 5.7 and triglycerides are 150. Some of the assessments, like I said, she's lost 20 pounds. The goal is that she continues to exercise daily, take her medication, and make healthy food choices. Nursing interventions, the short-term goals for the patient is continue taking medications, make those healthy food choices, and those long-term goals obviously was to continue to lose weight and exercise, maintain healthy food choices, and continue to exercise. Some questions for stage 3 is what is a good long-term goal for this patient? A good long-term goal is to lose an additional 60 pounds. Hopefully in that first year, losing weight will help, and the maintenance of acceptable blood levels. This includes cholesterol and blood sugar. Will help also help lower her blood pressure, which could prevent a stroke in the future. Second question is, how can family members provide additional support? Well, the best way is to support her by exercising right along with her and eating the same diet. Obviously, family plays a big role, and if they can all work together, then they can all probably potentially become healthy, and if they may have any issues as well. Enlist the whole family will ensure that our health for everyone. Here's a list of the references used for this